Okay, so welcome to part 4, Lifestyle Pearls for Midlife and Menopause. In this section, we're going to kind of focus on pillars of health, sleep, nutrition, all the different parts and pieces to really help you during this time frame. So when we talk about the pillars of health, I like to break it into 4 pillars: sleep, nutrition, movement, and your stress reduction. Optimal sleep for most people is going to be at least 7 to 8 hours. In terms of nutrition, we're going to talk about protein and meals and what that should look like, how much protein you should be getting as a midlife woman, weight-bearing exercises, and then stress reduction, setting boundaries, meditation, relaxation, social outlets, journaling, and mindfulness. In terms of sleep, in terms of the sleep and menopause, insomnia and sleep deprivation and just uninterrupted sleep really plagues us on so many levels. According to the National Sleep Foundation, 61% of menopausal women have a sleep problem. And oftentimes sleep is a disruption because either you're waking up with hot flashing or night sweats, which is often because of your estrogen. I usually say progesterone is the piece that puts you to sleep. Estrogen is the piece that absolutely keeps you sleeping. And that can be one of the things. Anxiety, you can be anxious because maybe you know you have sleep issues, and so that plays in. Weight gain and snoring and sleep apnea. You heard me talk about sleep studies in some of the other sessions. And then estrogen and progesterone really kind of help regulate those neurotransmitters that affect your sleep and wake cycle. So I think it's just all this important things to think about is that sleep is so important, not only during this transition, but in all phases of our life, and everything is going to be impacted with poor sleep. So here are some sleep pearls. I think that it's really important to practice good sleep hygiene. And basically the way I talk about it is that if you can try to have some consistency for a few weeks, that helps to build those better habits and establish circadian rhythms. You can try some different types of oral supplements: melatonin, magnesium glycinate, some inositol, vitamin D, valerian root. There's CBD products. There's also some really, really good app trackers that are out there. There's the Oura Ring, there's the Fitbit, there's the Whoop. And so all these different kinds of trackers can also tell you how you're sleeping. Also, another thing is that you can always use a continuous glucose monitor for a month or two and kind of track your sleep, make sure that it is in line with what you're eating and that you're eating enough before bed so that you don't have drops in your blood sugar, which can definitely wake you up as well in the middle of the night. So just things to kind of be thinking about as well. In terms of best sleep practices, you want to try to go to sleep and wake up at the same time every day, if at all optimal. If you can meditate for 10 to 15 minutes prior, that's also wonderful and important. And then create that bedtime routine, trying to get down at the same time every night, putting away your cell phones, making the room nice and cool because you sleep better when it's cooler, maybe some cooling sheets, cooling blankets, cooling pajamas, and then setting down your phone so that you're not scrolling on the internet. Switching off those devices at least 30 minutes prior to going to bed is also really important. You want to make sure also that you're not doing any kind of stimulants and maybe cutting those out around lunchtime. That would be caffeine and coffee and things of that nature. We talked about keeping your room cool, avoiding really large meals, but it's also really important that you're getting enough protein in your diet as well so that we can make sure that you are feeling optimal and sleeping through the night. Exercise is also really important. Get out, get movement. That also helps with sleep function. Let's spend some time on nutrition. Daily protein intake really is important, and it should fall in that mid to upper range of that 1.4 to 2.2 grams per kilogram a day. For women at all stages of menstrual functioning, peri, post, premenopausal contraception, protein evenly dosed and distributed throughout the day is really important. So I usually try to tell my patients somewhere around 1 or so grams of protein a day per body weight. So like if you weigh 100 pounds, 100 grams, give or take, that's an easy way, or 30 grams per meal. You want to make sure that you're getting it at least 3 times a day. Fiber is also going to be really important. Fiber, 25 to 35 milligrams a day, that's really going to also help with visceral fat. Visceral fat is the fat that surrounds your organ tissues and leads to cardiovascular disease and changes. And so increasing that fiber and making sure that you're getting it and keeping your bowels moving, that's also really important. It's also important that you allow yourself to have some of the sweets and things that you want. Again, moderation and enjoyment. The more you deprive yourself of something, the more you're going to want it. So it's important to think about that. And then it's also important to be thinking about color in your plate palette. So veggies and salads and things that have a lot of that color are going to be those low inflammatory foods and less of that processed foods. In terms of muscle mass and menopause, that's going to be associated with just that natural decline in estrogen that increases that visceral muscle mass. It's really important during this time on bone density and strength. Adults are going to lose about 3 to 8% of their muscle mass every decade. And at age 30, a loss accelerates 5 to 10%. So we've talked a little bit about just osteoporosis, osteopenia, the risk factor sarcopenia as you start to maybe lose weight. A lot of people these days are using GLPs. It's great for weight loss, inflammatory benefits, but some patients are definitely noticing that they are losing some of their muscle mass when they take these medications. So really important to think about. Movement is so important for our brain and our body. It helps with releasing endorphins. As I said, it helps with sleep, but it also helps improve that insulin sensitivity, leading to insulin resistance and some of those other things. It maintains that muscle mass, and of course, it's a stress reliever. So even if you just get out and walk every day, at least for a little bit, that's great. And even if you can throw on even a weighted vest, if you're not big on going to the gym, I think that's also another important alternative. In terms of movement, I usually will write a little RX for my patients with it. You want to try to move every day. If you could be doing weights 2 to 3 times a week, work up slowly to those heaviest weights. I think that's important. When you're doing cardiovascular, I don't say that I'm anti-cardio, but I want you in zone 2 where you can be having conversational movement. The greatest strength building stimulus is working up to doing big lifts, things like squats, bench presses, deadlifts, and heavy lifting. 4 to 5 sets of 6 or fewer reps. That's important. You really want to make sure that you're kind of achieving those levels. And then again, also adding in things like yoga and mindfulness and things like that as well too. That's also going to help in all these parts and pieces as in midlife. In terms of stress reduction and your mental health, you want to check in with yourself. You're going to see that there are going to be prompts in here for journaling and reading and meditating. Getting outside into nature is important, especially when the weather's nice. Those really kind of help us with just these grounding practices and honing in into our mental health. Boundaries are important. Be able to say no, be able to say yes when you want to say yes, but no is totally okay too. Self-care is so important during this time frame, and for a lot of us that are empaths and people pleasers, this time frame can be really hard. So set those boundaries and also make sure to form those social connections, because sometimes during this phase you feel so alone, you feel so out of sorts with yourself, and a lot of us become more introverted during this time. So just some important things to be thinking about. Vitamins also play a really important role in this time. So it's really good if you can be getting most of your vitamins from your food and through your nutrients, but sometimes we'll need to supplement. So calcium, approximately 1,200 a day. Most of us do get this in our diet, things like green leafy vegetables, but you don't really need this huge duffel bag of supplements. I sometimes think it can be more toxic on our bodies. So even though people get nervous about taking medications and saying that, oh my gosh, it's prescription strength and they're FDA approved and they're great, supplements also carry those worrisome things because they're not FDA approved. So you can over supplement. So you just want to be careful with that. In terms of vitamin D, it's a fat-soluble vitamin, so it's stored in that liver and in our fatty tissue. It's a little bit different than some of the other vitamins that are out there, but it becomes a hormone in your body. I kind of call it my pre-hormone, and what we know is that it's really kind of a precursor to steroid hormones. Its levels should be somewhere in that 60 to 100 range optimal. Most of us are getting it through sunlight, but during the winter months, I often recommend at least supplementing since we're not getting as much natural sunlight. The goal of vitamin D, like I said, is going to be somewhere in that 60 to 100 range, and my dosing for my patients usually is going to be between 2 to 5,000 international units is what they should be taking, closer to the 5,000 units in those winter months, just because you're not getting as much vitamin D. In terms of other good supplements, there's magnesium, which is really wonderful for sleep, constipation, bloating. I often recommend it at nighttime. I like to do it as a magnesium glycinate. Vitamin B12, that's really good for just energy, headaches, fatigue, things of that nature. Probiotics, I think a lot of things start in the gut. And when you go down the road of using hormone therapy, I think it's important to just look at overall gut health. A multivitamin, I think it just depends on what your diet looks like. So for stress and anxiety, sometimes some ashwagandha or L-theanine will help with that. Turmeric can also be really good for inflammation and joint pain. And then creatine as well for just overall muscle support. These are some of the things you can leave out. Some things get a little woo-woo, a little Wild West out there, but things like wild yams, progesterone creams, you're never going to get enough progesterone in a cream formulation because it's too, it won't pass the skin barrier. It's too much of a barrier to the skin, so it's never going to give you that endometrial protection. And we can talk about that as we go into hormones in that discussion, but it's not something that I recommend for my patients. I also want to talk about this word of adrenal fatigue. A lot of patients come saying they're tired, they're not feeling like themselves. I don't love the word adrenal fatigue because it's not a medical term. It's more of a slang. And the sad reality is where we have that you're in adrenal crisis and failure, or you have that everything's fine. There's no middle ground. And that's kind of why it came up with this word adrenal fatigue. And I do believe that the symptoms exist where there's this overtired, your stress is increased, you have a lot more cortisol and things in your body. But sometimes those symptoms often get overlooked by healthcare providers. So I don't necessarily use the word adrenal fatigue because it's not looked at in the evidence-based world, but I do believe that there is this fatiguing that happens in this midlife, and it really is impacted by stress and hormones and all those different parts and pieces. Okay, so up next, we're going to discuss hormone therapy as well as non-hormonal therapies in the next couple of sessions. So I will see you over in part 5.1.